Welcome back to Healthwise. I'm Reggie Tatum, and with us again is our special guest, Dr. Carl Gonsoulin, a pediatric dentist from Lafayette. Doc, tell us a little bit more. Well, you mentioned earlier about wearing the mask and making sure the kids don't trip, and making sure that their costumes fit and stuff. And how often do you end up with, I guess, injuries to the teeth during the Halloween time? I mean, from falling and stuff.
Well,
like
it can happen. You know, fortunately, we don't have a whole lot that going on, but it can happen. And a lot of times, if they fall down, some of the times, the first thing that hits is the tooth, and we don't want any broken teeth. If your child should have an injury to the tooth, it's a very good idea to have it checked right away. All right, as quickly as you can. You know.
Okay.
If you can't get it, especially if it's outside, you know, where there's dirt involved or something like that, you should maybe have it checked out at an emergency room or something like that. If you can get a dentist to see how.
Yeah,
after hours, that might be a problem, but definitely get to a dental office as soon as you can to check any injured teeth. Even though it may not be much, it's hard to tell exactly what's going on. Sometimes an injury looks a lot worse than it is. Sometimes an injury is a lot worse than it looks. And so it's always a good idea to check it out, get an x-ray done, or see something. Maybe something needs to be done to make the tooth more comfortable, or to save the tooth in some way.
Okay. How often should, not only during this time with Halloween and the candies, but how often should a child be brought to the dentist?
Well, children, they're at a susceptible age because their teeth are growing, their diet is, they're at least 2 times a year in most cases. We definitely recommend children to come in for their regular checkups. Okay, that is because their teeth are growing, the mouth is growing, things are changing. You can have an area that could be starting, or susceptible areas, and in 6 months or longer than that, it can be a cavity, and you want to catch it before it gets to be a big problem. And also, you want to make sure that the prevention is going on. The best teeth we ever have to fix are the ones we never have to fix.
That's
okay,
right.
And I'd much rather say, Mom, look, no cavities, than have to say, we got to do a couple of things here or something like that. And prevention is the key. The kids don't have the ability when they're young to take care of their teeth, and when they're older, they may not have the desire, so we have to help them out a little bit on this. Okay? And getting that good education, making sure that prevention is being done at home, makes all the difference in the world.
Do you think that nowadays, I know it didn't seem like a lot of kids had cavities when I was young, which was a long time ago, but does it seem like that more kids are getting cavities at a younger age now?
Well, to me, there's not been a significant reduction or necessarily a significant increase. Okay, cavities is the most common disease in children. Okay. And of all the things that exist, okay, all right. And the sad part about it is that almost all of it can be prevented. Mm-hmm. And it's fairly easy to prevent it. Most of it occurs because their parents didn't know it could happen, what to do to prevent it, and it starts at a very, very early age when the teeth first start coming in. So,
I guess, explain, Doc, exactly what is a cavity? What is that? You know, I mean, you and I have talked about it before, but for the audience's sake that don't know, what exactly is a cavity?
Well, cavity, the root of the word cavity comes from the same root of the word cave. It means a hole, okay, all right? And what the cavity is the enamel surface of the tooth, the white part that you see on the tooth, okay, is a very hard surface. But it is susceptible to problems. And when you have a germ covering over the teeth, coating over the teeth called dental plaque, the germs, they live on things. They live on starches and sugars, okay? And they convert these starches and sugars through their process into acid. And the acid dissolves the enamel surface. Like if you took lemon juice and you just left it on your tooth long enough, it would start dissolving the enamel of the surface because it is of the acid content of the lemon. Well, the same thing with the plaque. Takes the sugar and he turns it into acid, and the acid starts dissolving. And finally, it starts dissolving a hole in the tooth. The hole gets bigger and bigger, and finally, it gets to the part where it starts hurting, or it gets to the part where it starts infecting the nerve of the tooth. Okay? Then when you have an abscess, that's where you actually have an infection of the tooth, where the soft tissue, the nerve inside the tooth, is starting to get infected, and you can have swelling and pain as a result. And some of this can be very, very dangerous.
So it can be life-threatening sometimes,
Absolutely.
right?
I mean, people have died. It's unusual, but it can happen. People have died from infected teeth, okay? And we see kids come in that have, you know, pretty bad infections, and we don't want to have them have to go to the hospital and spend a week in intensive care to get over that.
Sure.
Know? Especially, it can be prevented. You know?
Right. Well, so very young kids, if you know, I know it's one thing if a kid can come and tell you, "Mama, my tooth hurts," or whatever, but a baby, you know, what are some of the signs? How would you know, or would you know unless you?
Well, this is the thing. When the teeth come out, the tooth is there, the germs are there, the food is there. Anything you need to cause a cavity is there, okay? Now, if you got my kind of luck, you'll get the cavity, okay? So you don't want to be dependent on luck. The secret of this is the parents have to be aware that the problems can occur very, very early, okay? We're talking about 2 years old and younger. They can come in with very large cavities. We've seen 18-month-olds. The youngest I've fixed a cavity on was 14-month-old. Okay.
Wow.
Now that tooth hadn't been in the mouth very long. Okay,
No.
all right, and many times we've seen 2-year-olds, 2.5-year-olds coming with very big cavities. Okay, all right, and that's only because the parents didn't realize it could happen. Very seldom is the fact that they had some kind of defect on the tooth. That's very, very rare.
Yeah.
Most of it is there's something going on with the diet. Many times at the young age like that, they're going to bed at night with a bottle that contains milk or juice or formula. Something that the bacteria can use to cause the problems. Now, bottle, I don't have a problem with the bottle, okay? I have a problem with what's in the bottle. Water in the bottle causes no problems, okay? All right? Milk, juice, formula, and stuff like that. Now, of course, if they need the bottle to eat, they need the bottle to eat. But once they're done with that bottle, it should be just, when they're done with the eating, it should be just water, okay? And they shouldn't be going to bed at night with a bottle that contains anything but water. Or they shouldn't be walking around all day long with a bottle that contains anything but water.
Right.
And when they graduate from the bottle, I recommend just water in the sippy cup. Okay? All right. But the parents should be aware that it's their responsibility to look in the mouth, keep the teeth clean, and make sure that the child is checked, because they're not going to be able to see everything they need to see.
Sure.
All right? And get the instructions they need to know so they can take care of the child easily, and the child doesn't have to go through all the problems.
Okay. Well, Doc, we're going to talk a little bit more about that when we come back after this brief message from our sponsors.